back, as today is her first meeting officially back.
Thank you.
Oh, sorry, there was someone unmuted. So welcome back, Mireia, and yeah, we are very happy to have you back in the COP. Today we have a presentation on a policy paper that was developed by CAMEALEON and the Arab Reform Initiative on how the social protection systems are coping and reacting and the challenges that they are facing in the response amid Lebanon's crisis and war. We are actually today, it's an interesting day to have this conversation because we have positive news that a ceasefire was reached for Lebanon. So it's very positive news, and it makes the conversation around this paper also kind of a collaborative brainstorming opportunity to understand how the challenges might change in the changed context. So we are very happy to have Cynthia with us, who will be presenting today. As always, we will have the structure that we normally have. So the meeting will last 1 hour. We will have the presentation for about 30 minutes, and then Mireia will facilitate an open discussion around the recommendations and the findings that will be presented today. We would also like to put in the chat, and I will just send it now, a link to register to CAMEALEON and ARI's mailing lists in case you would like to engage with them, to follow up on the conversation that is happening around the paper and beyond, to follow what they are doing in their work. So in case you are interested in joining their mailing list, the link is in the chat, and we will circulate it as well afterwards with the resources linked to this meeting. So without further ado, I will leave the floor to Cynthia to share the presentation to guide us through it. Thanks.
Okay, thank you, and thank you so much. Also, it's good to see. Thank you, everybody, for joining. It's great. Thank you so much. So I will be opening up my presentation now. Can you guys see my screen?
Yes, we can see it.
Okay, perfect. All right. Okay, so hi, my name is Cynthia, and I'm Social Protection Policy Advisor with CAMEALEON, and I was seconded by, I was hired by Oxfam Lebanon and seconded to CAMEALEON as to support the team and in the social protection regarding Lebanon, among other things. So today I'll be presenting the policy paper that CAMEALEON and ARI developed back in October. And this was before the Lebanese government started to act. So I would like to keep that in mind as I present. So things have happened after this policy paper was released. And there will be a summary at the very end of the things that have happened and what has, like basically an update post the release of the paper. So first, I'd like to introduce what CAMEALEON is. So CAMEALEON is a research learning initiative in support of humanitarian and social assistance for Syrian refugees and Lebanese. And basically, CAMEALEON produces research on the relevance, effectiveness, and accountability of cash and voucher assistance and social assistance programs, and supports the dissemination through learning events, multimedia material, and knowledge-sharing activities. Like this is one of those opportunities. And basically, we also have a lot of things in the pipeline, like a lot of work in the pipeline for 2025. But the most recent study that we're about to release is the one about the impact of basically of misinformation on CVA. And so this will be released and next week or so, something like that, I guess. And please register for the mailing list if you'd like updates on our activities, among many other things. And we have other advocacy papers in the pipeline as well related to cash. And I'll mention this throughout the presentation, why we will be releasing an advocacy paper on the need for cash in Lebanon, basically. I'll get into this later. Anyway, so again, I just want to emphasize that this was written before the ceasefire in October. So the Lebanon situational summary, the escalation of hostilities leading to the outbreak of the war on the 23 September 2024 have displaced approximately 1.2 million people, leading to increased vulnerability and displacement everywhere throughout Beirut. And honestly, people didn't know where to go, and people still don't know where to go, but hopefully with the ceasefire, they'll be able to return home, and despite all the infrastructural damage that was done. And so the social protection system, prior to the obviously escalation of events as well as the war, was already fragmented and underfunded, and was struggling, and was at the time struggling to meet the needs of the humanitarian needs of the affected population. I mean, this goes back to the shock responsiveness, the role of social protection in shock responsiveness. So the emergency response at the time has been inadequate and limited to cash transfers and in-kind donations reaching a small portion of the population. So basically, the war and displacement had begun since October 2023 and had persisted, but obviously in the past 2 months, of course, displacement of course increased, but before the war there was like approximately 100,000 displaced people already, and there wasn't a lot of activity at the time. I mean, very limited activity despite people being affected by the war, livelihoods, health or otherwise. So basically, in response to the war and the escalation of events, Adi and basically CAMEALEON decided to work together to be able to write a paper and propose policy recommendations in order for people to in order for the government to be able to act accordingly and in ways that are consistent with values of social protection and the social protection pillars. And this had to be done very quickly, and we tried our best. Me, Diana, Tonya, who's no longer with us, and Farah Shami from ADI worked really hard to get this paper out as soon as possible, given the context. And so the purpose of the purpose of the policy paper was to assess the current social assistance response to the war, provide concrete policy recommendations to support the immediate action required, and finally draw lessons learned to help devise a more shock responsive and resilient social protection system for the future. And hopefully, I mean, with the ceasefire, which, ceasefire was reached yesterday, it's great. I mean, it started at 10 a.m. today, but still. So the social assistance programs, just as a summary of what they are, and which pillars, which mechanisms were used for the response. To the emergency. And so Lebanon social protection system primarily relies on poverty targeting social safety nets, which offer limited coverage and are heavily dependent on international funding. And basically, they also cover 20% of the population. So basically, the first one is the National Poverty Targeting Program that was established in 2011, but was expanded to cover 75,000 of the poorest Lebanese households following the economic crisis and the COVID-19 pandemic. And so then this is primarily run by the Ministry of Social Affairs and in partnership with WFP, who basically does the cash transfers, and funded by the EU. So then also in response to the COVID pandemic, as well as the economic crisis that took place in 2019, the World Bank worked with the presidency of the Council of Ministers to establish the emergency social safety net, which was established in 2021 and targets 150,000 of the poorest Lebanese households. Now, at the moment, it's benefiting 160,000 Lebanese households as of November 2024, because the National Poverty Targeting Program was basically phased out. And that was the plan all along, from what we understand and from what stakeholders have known. They were meant to phase out the National Poverty Targeting Program and transfer all the people who were eligible for the ESSN. And they currently, from what we're understanding, so far 65,000 people from the NPTP have been transferred to the ESSN. And so the third and final one is the National Disability Allowance. and is a shock responsive social grant. Sorry, I think somebody's yeah, thank you. Sorry. So the third one is the National Disability Allowance, and basically it was established in 2023 and to benefit 20,000 people with disabilities. Now it's currently at 27,000 people with disabilities of all nationalities, including Lebanese, Syrian, and Palestinian refugees. And basically the portion of people that are Lebanese people that are benefiting from the NDA are basically run on. It's basically they benefit from MOSA basically in coordination with UNICEF and the ILO, and this benefits people between the ages of 15 and 30. All right. Now an overview of the social assistance response in Lebanon. Again, this was this was in October 2024. The social assistance response has mostly consisted of one-off payments and limited top-ups to 20,000 to 31,000 beneficiaries and beneficiary and non-beneficiary households. And basically, as a summary of what exactly was done from October 2023 until October 2024. Well, basically, there was a one-off cash payment transfer of 100. It's basically a top-up, and it's one-time transfer of $100 to 3,864 people with disabilities that are Lebanese specifically. And then another one was done in October 2024. Again, a top-up of $100 to 5,000 Lebanese people with disabilities. And then through the social safety nets, I mean, the government already knew that the situation was getting worse and worse. But at the same time, there was very limited transfers between October 2023 and October 2024, where there were only 4 social safety net transfers. Well, there were only 3 before October, actually. So basically, there was one transfer in 18,000 Lebanese households that were discontinued. They were either discontinued from the ESSN or registered with the NPTP, but were not receiving assistance. This was done in January 2024. And then another 2 one-off payments were made in June and July of 2024 to 11,000 households, or 12,000 households approximately, to beneficiary and non-beneficiary households of the NPTP. If you guys want to know the values of the transfers, please ask me at the very end, and I can tell you exactly how much people were benefiting. Basically, the people that were registered and benefiting from the NPTP would receive a top-up, and the people that were non-beneficiaries, but registered with the NPTP, would receive $145 per household. And so the 4th transfer took place in October 2024 to almost 10,000 households of beneficiary and non-beneficiary households of the NPTP. And from what some people have told me, and from what a lot of people have been speaking about, all the transfers that were made to people who were affected by the crisis and displacement, this was basically calculated by WFP using the Conflict Impact Index, which basically takes into account places that have been severely affected by this is not mentioned in the policy paper, but this is something that we acquired as knowledge later, where they use the Conflict Impact Index that takes into account the areas that have been most affected by displacement and by civilian damage. And this is used, I think, in coordination with the IOM. And the DRM, I think. Disaster Risk Management Unit, which is the body that is basically in charge of the response at the moment. But the Ministry of Social Affairs has control of the social assistance part of the response. So, and then after, like in October of 2024, after the escalation of events that took place on September 23rd and began to escalate from there, the Lebanese government launched a flash appeal through the United Nations, calling the donor governments to support estimating Lebanon's current need at $425 million for comprehensive and effective response headed by the National Disaster Risk Management and the Ministry of Environment, with a specific focus on the Minister of Environment himself, which is Dr. Nasser Yassin. And however, the mention of cash in the appeal is limited. Just to make that clear, and the coordination bodies and certain donors have expressed reservations over the disbursement of cash and asked humanitarian actors to hold off on disbursing cash and suggested in-kind assistance as an alternative. Now, this is not mentioned in our policy paper, but this is relevant to CAMEALEON's work because we've developed an advocacy paper about cash and the need for cash and the use of cash because it's highly favored in several contexts, especially where markets are functioning, like in Lebanon. So please register on our mailing list to be able to get access to this paper, which is hopefully going to be released next week. And yeah, because of how limited the cash assistance response has been. And the reason, from what we're understanding, the reason why the government is asking humanitarian organizations and other actors to hold off on disbursing cash is because they want to be able to register people outside, like IDPs outside of collective shelters. And but this will take a bit of a long time. I will speak about this later because this is a concern that happened again after the paper was written. But yeah, there are several updates that will be mentioned. There's also no mention in this flash appeal. There's no mention of social safety nets or the NDA. And also there has been confusion on the role of each actor and government or otherwise, because now it's becoming a little bit more structured, but still there are a lot of problems from what we're understanding. But basically at the time, there was a lot of confusion on registration and who would be in charge of who. And also the DRM was not, basically did not want people, like, I mean, they only cover Lebanese people and not refugees. Like by refugees, I mean Palestinians as well as Syrians, where basically they didn't allow refugees to go into collective shelters. But at the same time, I mean, in terms of coordination, it's just, I mean, in terms of also deduplication efforts, this is very important to be able to disperse cash and not to miss anybody and to include as many people as possible in the response. So deduplication has not been a thing yet, but I mean, at the current moment, I will mention this again later, but there's a lot of efforts in that direction at the moment, but there are a lot of issues related to that as well. So gaps, needs, and opportunities for shock responsive social protection. So first of all, since for like basically all social safety nets already are limited in their coverage and only cover 20% of the population. And since Lebanon relies on social safety nets, basically this doesn't allow also, sorry if I'm boring you guys, but I also hope this is interesting. Anyway, so there's a significant gap in social protection coverage due to insufficient sustainable funding and limited eligibility criteria for social assistance programs. Now, as we know, and as a lot of studies have shown, basically social safety nets can be inherently exclusionary. But I mean, it's still important for cash is very important and poverty targeting is important, but it shouldn't be the only thing because it's not universal and it only covers certain households and it sometimes misses the populations it intends to target. And also, so in terms of unsustainable funding, the NPTP, ESSN, and NDA all rely on donor financing to disperse cash to beneficiaries, where the transfer value and volume varies according to donor commitment. So, I mean, of course, there's a lot of different conflicts going on in the world, especially in terms of Gaza and as well as Ukraine, everything that's going on in Ukraine. So at some point in time, donors were reluctant to transfer money to Lebanon because of this change in the dynamic and in what's happening in the world. So basically, in terms of it's basically not very it's not very sustainable in the way we have social safety nets in Lebanon because they're not tax funded. And this is something that's been mentioned several times in several other contexts aside from this presentation. And it's really important for there to be tax reform in order to be able to fund these social assistance programs. But yeah. And so there was also another thing that happened. What's it called? As the situation was escalating, basically, at the end of December, 2023. So basically in December 2023, the government announced that donors did not want to fund the NPTP, and they asked that there should be re-verification and unification of social safety nets of the NPTP and the ESSN, where all the NPTP beneficiaries would be transferred to the ESSN. And it's very important to have a unified social safety net and unified social registry. This is extremely important, especially for duplication efforts. But at the same time, there was an escalation of events, and a lot of money was not being allocated to people who were being affected by the crisis and by the war, by displacement and by different things. And this is, I mean, it took kind of a precedent, but it was a necessary thing to happen. But this should have happened perhaps prior. But at the same time, still, the government could have reacted a lot quicker to people's needs because people had been displaced for a very long time now. And so now we get to the policy recommendations. So we recommend, of course, the expansion of social safety nets, vertical and horizontal expansion using this new social registry, hopefully, is being finalized. And according to the Minister of Social Affairs, it should be finalized by November of 2024 now. And a lot of the beneficiaries have been transferred to the ESSN already. So the government should expand social safety nets to include all populations registered with social safety net database in affected areas, and further increase the value of top-ups and transfers. Again, okay. Anyway, so I'm going to continue. And then also a horizontal expansion to include displaced populations. The single registry should open a dedicated online platform for the displaced population through the DAM online platform, which is the ESSN's platform. Because the way you register for the ESSN is online to the Emergency Social Safety Net. And so MOSA, the Ministry of Social Affairs, should partner with CSOs, NGOs, and UN agencies to support the expansion through in-person registration via local development centers for those unable to do so online. But of course, there's a lot of distrust in online platforms, especially for Lebanon, because a lot of people don't, I mean, now it should be different, but at the time, a lot of displaced people wouldn't want their whereabouts to be known. And a lot of our partners are saying, at the time, we're saying that a lot of people were reluctant to be able to engage with and give them addresses because they were scared of of Israeli strikes and among other things, which makes sense, honestly, at the time. And I don't know what will happen in the next 2 months after the ceasefire will be over. I mean, yeah, hopefully it'll work out. And then so recommendations on the financial level, because there's a lot of unsustainable funding regarding social safety nets. So first of all, we recommend the allocation of government funds. Since government constraints limit, from international donors, limit the disbursement of cash to the most vulnerable, the government should consider opening credit lines or allocating funds through the government's budget. So basically, it should be important for the government to be able to realize that it should be funding its own social safety nets and perhaps even transition to other more life cycle vulnerability based programs such as a social pension or a child grant, and now with the NDA, which is one of the first ever life cycle vulnerability program in Lebanon. And then also another thing is to develop financial mechanisms for social safety nets. Now, I just want to say something which is about the NDA. The government actually has allocated money to the NDA in its last budget, but the problem is that they don't have the mechanisms to be able to transfer this money. So what would happen is that now at the current moment, the ILO is trying to help it develop a channel for it to be able to transfer money from its budgets to the beneficiaries. So the channel is currently being worked on, and from my understanding, it's actually way underway. So a lot of progress has actually been made, which is great. But anyway, I'm going to continue. So yeah. And then emergency decrees. In order for all of these things to happen, in order for government funds to be transferred, you always need emergency decrees through the presidency of the Council of Ministers. And through the use, of course, the unified MPTP social safety nets. And then finally, of course, the harmonization and coordination, which is, of course, the ultimate goal in terms of social protection, especially shock-responsive social protection in contexts where there's not a lot of coverage of the population, where deduplication efforts as well as other things should be prioritized to be able to reach as many people as possible. So coordination and data sharing. MOSA with partners and actors should establish a body to coordinate between humanitarian assistance and social assistance and develop data sharing agreements and deduplication mechanisms. Humanitarian organizations, humanitarian actors should seek a complementary role and strengthen existing capacities as opposed to creating parallel systems that require an extensive roadmap for handover. So eventually, I mean, that's exactly how it should work out there. There should be definitely a lot of coordination between humanitarian organizations and the government to be able to, again, reach as many people as possible, and as well as potentially hand over people affected by the crisis and vulnerable people to the social protection system when it's able to basically absorb them. And finally, donors should ultimately channel resources through existing systems and avoid funding and creating parallel humanitarian responses. But Lebanon, I mean, as well, Lebanon has a history of doing this sort of thing. But I mean, the WFP as well as several other actors have developed different mechanisms that are sort of parallel, of course, but at the same time try to work in parallel with the government. And yeah. So in terms of in terms of lessons learned, to guarantee and improve shock responsive social protection and to ensure that everybody is covered and to leave no one behind, there was a national social protection strategy that was released in February of 2024 that basically lays out, it's like a roadmap to basically life cycle vulnerability-based shock responsive social protection to support people in crisis and non-crisis periods. Like, for example, if there were certain life cycle vulnerability-based responses, from what I'm understanding, this is something that has been used a lot in Ukraine, where a lot of people, where humanitarian organizations have been working with the government to be able to support people and, I mean, further expand its social protection system to meet the needs of as many people as possible. And first of all, there's also the government should implement the pensions law. That was passed by the government in December 2023, which was a landmark, basically, reform, because they had been waiting for it for 20 years. And although the national, basically the national pension system in Lebanon it requires a lot of reform, but nevertheless, this pension law should be implemented. And also, finally, the government should invest in building the infrastructure and capacity of a universal rights-based social protection system that prioritizes life cycle vulnerabilities and leaves no one behind. And finally, I think, there's 2 more slides and then I'll be done and I can start taking questions. We can start taking questions, sorry. So the recent updates on Lebanon social protection response, which was new, again, as I said, I was going to go through that. So finally, there's the unification of the social registries. It is being currently finalized, and approximately, I should have written 65,000 households, but basically 70,000 households have been transferred from the MPTP to the ESSN with a finalized social registry, which will hopefully help people and support and the harmonization of the response. So then there was an emergency one-time top-up of $100 to Lebanese NDA beneficiaries of all nationalities affected by displacement. So there was another one in November of 2024. And funnily enough, because we actually suggested this, we were suggesting that the government transfer some of the money from its budgets to the Ministry of Social, to social protection programs, which MOSA did, actually transferred some of its budget to the National Disability Allowance, which is great in terms of a step forward. And then 2 social safety net transfers were made in November of 2024, and another one again in November 2024, where MOSA, in partnership with WFP, have established an emergency shock responsive social safety net that has benefited 53,000 households. Now, again, what WFP and MOSA used was the conflict impact index, which is very important, I think, in order to understand who has been displaced. And so basically, so who are the beneficiaries of this transfer? Families that were registered but not receiving through MPTP, families registered with WFP but not receiving in-kind assistance, and IDPs registered with the Disaster Risk Management Unit since October 8, 2024. And then a second one was done in another one-off top-up was done for 16,000 households. And basically, this is a very important one, which was also done from MOSA's budget. That's how it was funded. But basically, it targeted vulnerable groups, which include female-headed households, a household with people with disabilities, and if they had elderly people in the family, basically. And and then finally, Lebanon's social assistance response, MOSA has finalized the identification and registration platforms for IDPs inside and outside collective shelters. Now, the whole thing is that the government had told humanitarian organizations not to hold off on disbursing cash until they could establish deduplication. However, they will be doing so in the next 40 days to be able to enhance the response. But the problem is that the government has always had issues in sharing data. So while they have introduced, especially in the last Basic Assistance Working Group meeting, they were talking about how basically all the methods or procedures that will be used to be able to transfer the data and deduplication methods. But at the same time, I don't think the government has the best history of sharing data, and a lot of our partners have mentioned how difficult it will be and how little trust they have in the government to be able to share data. It's like a historical thing, and if anybody has a question, please ask. And also now with the ceasefire, this is another thing. It's like, what will happen now with the ceasefire? So yeah, Q&A. If now it's Q&A time. Yeah. So
thank you so much. Yeah, thank you so much, Cynthia, for this super detailed and comprehensive presentation, and for the brilliant job that you have conducted in this report. So yeah, we open the floor for any questions, any reflections that you might have. So yeah, please unmute yourself or raise your hand. I might have a first question, so I can break the ice as well. So you say that the list have been unified, but I was wondering, so with the current war and displacements, etc., how the data has been updated, if there is recent updated of new households that might be vulnerable after this recent crisis, or how the work has been done.
I think Cynthia froze.
Yeah, I think, yeah, perhaps she has
she
issues
dropped
with the connection. Yeah. Okay, let's wait for her to come back.
Maybe, Maria, I can answer your question until Cynthia comes back. But sorry, I was distracted with lots of shooting happening around us because of some celebrations of the ceasefire. So if you could please repeat your question, and perhaps I can address it.
Yeah, no worries. So no, so in the presentation, Cynthia, she's back also.
Yeah, if she's back, then that's better. Thank you.
Yeah, I mean, if you want to answer, it's also fine. So
sorry,
yeah, no,
guys, my internet was acting up. My bad.
We saw you. Yeah. No worries. No, my question was that in the presentation you explained that the list have been unified in the social protection schemes, but my question is that if with the recent war and displacements, if this list could have been updated with perhaps new families, households that now they are vulnerable and perhaps before they weren't and they were not included in this list.
Am I supposed to answer? Sorry. Yeah.
Are you or Farah?
Yeah. I know that basically they established an online platform like we had recommended. And basically, I think that it's important to have a platform for people to register as displaced people and then have, as usual, social workers go and visit these people. So yeah, I don't know if that answers your question, but I think it's important for that to keep on going. Yeah.
Thank you. All right. Is there any question, any reflection you would like to share?
Maria, there is a question in the chat.
Oh, yeah. So is it possible to share more details on the rationale behind discouraging humanitarian cash assistance?
We'll be releasing a paper on this on this subject, basically. Hopefully, it's an advocacy paper. But from what our partners have told us, it's because they don't want duplication of efforts. This is the whole thing. They're like, we will finalize this, and then you can do your cash. But in the meantime, do in kind. This is what they're saying. But at the same time, we have functioning markets. So some humanitarian organizations, such as one of our consortium members, Oxfam, is already doing cash there. Like we have our communities, we have our local people. So they will do it regardless. But because also there's a lack of confidence in that. But basically, they just want deduplication efforts.
Great, thank you.
To assure, sorry, I'm reading the chat box now. How to assure there is no duplication with beneficiaries. Between, do you mean humanitarian and social safety net beneficiaries? Okay, so so basically from the last basic assistance working group meeting, people from the Ministry of Social Affairs came in and they said, they're brilliant though, I like the members anyway, especially Dr. Ala Butros. If anybody wants to email her, let me know. But basically, you would apply a certain list of names of people, and they in turn, like, you mail it to the presidency of the Council of Ministers, and basically they give it back to you and tell you they're beneficiaries or not. But again, this has been a difficult thing for humanitarian organizations prior to the conflict. But now with the Unified Social Registry, anything is possible, because a lot of efforts have been made that I didn't think would happen, like actual money being transferred from the government's budget, which is irrelevant to this. But at the same time, I'm assuming there hopefully will be a better political will to allow people access to this data, because the government has been very secretive about its data, specifically when it comes to the access to the list of NPTP beneficiaries, because it's kind of a black box and there's a lot of politics behind it. But at the same time, hopefully with these procedures, that's what will happen, if that makes sense, if that answered the question. Okay.
Thank you, Cynthia. And Luca, if you want to go next.
Thanks, Mireia. Well, actually, I think the two questions before kind of answered my question already. But at a certain point, Cynthia, you said the government has made the appeal through the UN. So I wanted to understand how involved was the government in that process. But also, so now basically, as you said, like they're discouraging humanitarian cash, but what is the level? I mean, I understand there is not much level of trust, right, between the two parties. So to me, it sounds a bit strange, kind of humanitarian agency just sitting back saying, okay, the government says don't do anything, so we might do something low track, but in reality not showing much until they come up with a solution, the duplication on everything. And also linked to this, how much is the actual, so there were a bunch of recommendations there, but how much is the government actually able to pay this? Because I'm linking it to some issues we have in Palestine. The problem here is that the government cannot pay anything, right? So they have been trying to set some of those conditions you were mentioning in terms of data sharing, etc. But we are faced with a system where there are almost no payments, right? And so at the end of the day, we say, no, class, we go ahead because we need to serve people. So how's that working in Lebanon? That's kind of my question. Over.
Farah, do you want to go, or should I have a, okay. So basically, I think, so the government, how involved the government has been with the flash appeal in terms of developing it, or in terms of, in what way? In general?
Yeah.
No, so basically, the disaster risk management unit has mostly been in charge of the flash appeal, but there's also like a kind of disconnect between the Ministry of Social Affairs a bit and the disaster risk management unit. This is what we hear. This is all rumor from, this is not written anywhere. This is things that I hear, just to be very clear. So, and so basically there's a disconnect there because, and there's, I mean, I'm sure there are more coordination efforts than before, but it's mostly the disaster risk management unit that has been managing everything, but they've been focusing mostly on in-kind assistance, blankets, pills. But now with the ceasefire, I mean, people will have different needs, because people might return home, but at the same time, they lost their livelihoods, lost their, you know, you never know. We don't know if people, I mean, people are already returning to the south and to Baalbek. So we'll see what happens. And regarding your second question, yeah, the humanitarian organizations are not sitting back and saying we'll do this. In fact, they're a bit concerned about the whole situation, and they are still going about doing cash, because they have their own money at the end of the day. It's not like donors control everything. They have their own money, they have their funding, they'll allocate funding in the way that they see fit, especially if they, for example, with Oxfam, I'm just giving a very specific example. They have their communities, and they already have a lot of connections and partners in local communities where people are affected. Like, they're doing a lot of work in Saida, and they're doing a little bit of work with displaced people in Beirut, as well as in Baalbek. So in terms of responsiveness, they're not going to wait around for them to do that, I guess. Yeah.
Thank you, Cynthia. And Julian?
Yes, hello, thank you. Julien from UNHCR Lebanon, actually. So thank you very much for this presentation, and actually the report, which I had read before. I just wanted to emphasize, or to ask a bit more about the vertical expansion or transfer value increase. Because if I'm not wrong, in the report, when I read it, I didn't see it, and that was also one of my questions, and I see it in the presentation now. And I think it's been a long, not only due to the current situation, but for me, it's been a long question in Lebanon with the NPTP and the SSN when it was existing about the transfer values that doesn't evolve, and that one could consider quite low, especially in a situation of inflation. So I just wonder whether you have more to share, a bit more in terms of recommendation, acknowledging as well that there's always a tension between assisting more people, because as you said rightfully, already the system doesn't assist enough, but also providing a meaningful amount of assistance. So if you have a bit more, I'd be interested to know. I know as well it's sensitive, it's complex, but that's an important point. I think it's also need to be emphasized. And then second recommendation, and sorry if I missed it, did you do this presentation in Lebanon as well? Because I think it would be very useful. So I really invite you, if you didn't do, to the Basic Assistance Working Group, for instance, because I think many people will be very interested also to have this discussion.
In terms of thank you, by the way, thank you for those questions. In terms of vertical expansion, I actually don't know, because from what I understand, correct me if I'm wrong, but I don't think that there's a unified transfer value. Like there's no standard in the humanitarian community. Is there? Unless there isn't, I'm not sure. Has it been defined among all organizations? There
is a recommended transfer value for refugees, for the refugee assistance. It's a recommended, and then, but that's a key question. I think, to my knowledge, there's no recommended officially recognized for the Lebanese. So the standard becomes the safety net, as a matter of fact. I mean, I think it will become the standard. And then it has implication also for the refugees, because then the government will say, oh, it should be aligned, and etc. So anyway, everything is linked. So no, to my knowledge, there's no recommended. That's a question as well. And maybe also it's linked to the government positioning where maybe there are some difficulties there. I don't know.
Yeah, vertical, I think top-ups are very important to meet the specific needs, but I think a lot of the time in-kind assistance can supplement cash in ways, like especially shelter assistance. I think this would be very interesting, honestly, because not a lot of shelter. I mean, I'm talking in relation to the conflict. I'm not talking in relation to other things. Vertical expansion in the humanitarian sector beyond the conflict is a bit difficult. But I think in terms of this sort of thing, it depends on, of course, refugees and Lebanese have different needs. So of course, that makes sense that they have different transfer values, I guess. But at the same time, I think vertical expansion really depends on also how much donors are willing to give, aside from the breadth or depth argument that you mentioned. So I think it definitely depends on the funding available as well. So it's not only just about the vertical expansion itself and increasing the transfer value and what is actually required, but I think it's definitely limited to funding, which we've mentioned before. It's a real problem, the whole funding thing. So I don't know how much the government is able to pay or how much donors are willing to give at this point, but yeah, I hope that answers your question. You're muted. Yeah, you're muted. Yeah.
I'm still muted. Yeah, sorry. If I can may just briefly jump in also maybe for the whole community. I think that's again for me always an important question, because what you raise is, yes, there may be a lot of element to the transfer value. And you're right, it's not only vertical expansion. My question was also broader, but about, again, it's a question we have everywhere about tension, again, between increasing the transfer value when it's needed and relevant, and again, expanding to more people. So I don't know whether there are also other experience and also guidance, because this is always very relevant and always a complex question, because obviously most of the time, whether it's a national system or whether it's a humanitarian program, there's not enough funding to cover all the needs. So these questions of, again, transfer value versus breadth is critical. And I don't think there is any scientific way to address it. But anyhow, these are important things we need to keep looking at.
Cynthia, there is another question in the chat box. So since there is a lack of the duplication mechanism, is there a joint coordination mechanism on targeting?
The thing is, it's still in progress. That's the thing. The deduplication. I'm not saying that there is no deduplication efforts. There are, But this, deduplication has been an issue prior to the conflict. Like, definitely, deduplication has definitely been a problem because, again, the government is very reluctant to share data. But the fact that the government is even having meetings in the Basic Assistance Working Group with cash actors and humanitarian actors and clarifying that you do have processes now, that's a very big thing and it's a very big step forward. So now we made the recommendation that there should be joint coordination, and apparently somebody told me yesterday, and I didn't know this, that there wasn't a functioning cash working group in Lebanon. And literally a couple of days ago, yesterday, one of my colleagues from NRC told me that they've just established a cash working group. Having a cash working group is essential, and this is something that a lot of humanitarian organizations have been advocating for. But now that it's finally functioning under, I think, the inter-coordination mechanism, something like that, for the humanitarian actors, that's actually great. Maybe they would even be able to coordinate even more and have the government more involved. So the fact that they're moving forward in that progressive direction, I think, is telling, honestly. So that's my opinion on the cash working group. I hope will definitely benefit, the response. So there could be, in the coming months, there could be deduplication efforts, but I highly suggest that we just keep track of what the government is doing. And the way we can do that, which Farah rightly says, is that we should be tracking the government's tweets, because these things, like the Minister of Social Affairs and the minister himself and the ministry regularly tweet things about what they do. So these are very important things to take into account. So whenever, if you want to keep track of this, it's not the biggest Basic Assistance Working Group that you're going to want to be looking at. You can talk to key stakeholders, but looking on Twitter is a game changer. That's where I get most of my data. Like from the news slide, it's mostly from the minister's tweets and stuff. So we'll see what happens in the next couple of months, and hopefully there will be better deduplication efforts. Like, I'm crossing my fingers and toes, but there is, again, a lack of trust, unfortunately, but the government could very well change that with this response. You never know. Like, I never thought that they'd allocate money to like government budget to the social safety nets, social assistance programs like NDA. So we'll see. And the fact that they're switching more towards vulnerable groups like female-headed households, households with people with disabilities or people with the elderly. This is very important things. So I think we should definitely keep track, and we'll see what happens from there. So it's still a developing thing now, especially with the ceasefire agreement. So yeah.
And this is a question to Julien from Pahlavi. If there is no discussion on the basic needs working group on the transfer values. I see. Okay.
Yes,
Julien is replying.
I was just chatting, so maybe that's enough. But yeah, no, basically it's very much, no, that's a very fair question. And the response is no, not really until now, but this is changing indeed. But that's also full reorientation of the coordination mechanism. It used to be a LCIP in Lebanon, so very much a Syrian refugee situation response, because there was no humanitarian situation in Lebanon. So the social safety net was with the government, so it was not necessary. But this has changed, actually. The whole coordination mechanism since 2024 is broadening, and now indeed there is more linkages, which is very good, between, let's say, purely humanitarian and more social safety nets, including for Lebanese and other population, other groups. So this is coming, but yes, the transfer value discussion of the national safety net has not yet been fully discussed in this forum, because it was not placed up to now.
Great, thank you. Is there any other question?
Actually, now I want to ask Julien if any discussions related to the cost of living adjustments in the transfer values are underway, or because we haven't heard of this for a while now, and I think it's also really important that we think of this, especially, I mean, with the current situation and the CPI, if we are to take it as an indicator for the current inflation level, is fluctuating, but it's also it's always on the upper bound. So this is making safety nets and cash assistance inadequate. So yeah, so now it's my question to you, and on the coordination mechanism, it was just a note that I mentioned on the chat, but I also wanted to mention something that so there are many updates that happened after we wrote the paper, but one of them which like struck me, and I'm itching to say it because it's just one tiny element, but it's a big indicator of the attitude of the government towards the response, and that not only do we lack shock responsiveness and resilience, it's also that there is some I don't know, like nonchalance, or like it's a careless government. It's not a provider government. It's rather a careless government. So amid the war, they were reassessing the 93 something thousand households, and that benefit from the safety nets, and many of them were found to be ineligible during the war on November 6th. When the war was in the peak, many people, instead of expanding horizontally the safety nets, many people were excluded. Like many people stopped receiving any transfers. So this is not speaking about humanitarian cash, but even with the safety nets themselves, the response hasn't been accounting for the increased needs. Instead, it was degenerating with time. And if this is an indicator, it's an indicator that we cannot but have and rely on humanitarian actors, at least for the time being, but that the key entry point to improving the social protection system's shock responsiveness is to link this humanitarian assistance system with the social assistance system in the longer term, when we can build a stronger infrastructure for social assistance. But for the time being, whatever the government says shouldn't be taken, in my opinion, into consideration, because the government isn't able to offset for the lack of protection, and it's the humanitarian actors that are taking the heavy toll. So in the longer term, all we need is, so the government has a responsibility here, has a role to play here, but all we need is better and stronger coordination between humanitarian actors and the government in order to graduate beneficiaries from the humanitarian assistance systems to systems that are more long-sighted and more sustainable, or else we would be leaving them midway without at different points in time when these beneficiaries are still in need, even in the midst of the certain crisis or conflict. So the coordination mechanism between humanitarian actors doesn't exist. The coordination mechanism between those actors and the government is also symbolic. I would say it's just a box checking. But also there is no mechanism for this to strengthen these linkages between the two systems and to graduate. And we have this political economy of the government and attitude of the government that we're dealing with that is not really putting people center stage in a crisis response, which exacerbates the situation. This has no solution, but some governance reforms and reforms on the national level, but at least when it comes to the gap, bridging the gap between the humanitarian and the state-led, I think this is something that we have more control of, and as a community, something that you could push for more, and that is more that has got a stronger leverage point, I would say.
Thank you, Farah. And Julian, do you want to add to Farah's point before we move to a couple of questions in the chat box?
Yes, if I may, very shortly, because there was, and I know there are other questions, and there was many things in what was said by Farah. I will not go back on everything, but one thing I would really recommend, I fully agree with you, at least on, on the linkages, and I think there is a good ground. Again, the basic assistance working group, as I said, now the whole coordination, humanitarian coordination mechanism, which we shouldn't call humanitarian anymore, because now it's across the spectrum, is broadening. This is already acted. And the basic assistance working group is talking about this, or is supposed to be talking about that. It's actually co-led by the MOSA, and the new strategy, or the basic assistance working group indeed talks about that and has this as an objective. Now we still need to move forward, but what I'm saying is that the ground is now here to support better coordination, cross-learning, discussion between these different groups. I'm not sure I'm not saying it would be easy. It's never easy in a way, but at least there's been a progress. So hence, again, I would really encourage the CAMEALEON to maybe use the opportunity of your paper to present it in this group and help engaging the conversation and maybe action point and strategy. That would be very, very, very useful, I think.
Thank you, Julien. We have 3 minutes, so I would appreciate short answers and questions. There is a question on if the government funding is coming from the World Bank loans.
Wait, where is that? They said
in the chat box.
Yeah.
Yeah, there was so much great information in the slides. I may have missed this, but the government funding, is this coming via World Bank loans?
Yeah, for the ESSN, not for everything. NDA is funded by EU. WFP is funded. NPTP. Now I actually don't know where the funding is coming from for ESSN and the joint, but I'm sure it's EU and World Bank at this point. But ESSN definitely was and continues to be funded by the World Bank. So yeah. The World Bank, yeah, this was mentioned. It's the presidency of the Council of Ministers and the World Bank. So,
okay, great. Then I see there is a question from Mauro, but I see that you already replied about the targeting. I don't know if you would like to add something else.
I just want one question. If anybody has a recommendation on how they think because this is the communities of practice. This is something. There's 1 minute left. I don't know, but I think it would be interesting to keep in mind about how shock-responsive social protection can be used to respond to the needs of people now in the ceasefire, at least for the next 2 months anyway. I don't know what will happen from there. But it would be interesting to know how the government will respond, and whether anybody has insights and is willing to have a conversation. Please email me about this. That would be great. If anybody just has an idea or anything like that for the next discussion for the CEO, like the communities of practice, this would be very interesting to get people and practitioners' opinions on everything that's going on, because it would be interesting to come up with yet another paper or statement to be able to advocate for this. So yeah.
I don't know if there is any immediate reaction to this. Carla says that it will be good to link the cash working group or whatever nexus group with the social protection CBA technical working group in OPT and brainstorm on challenges.
Rana Nasser, I think, has her hand up.
Yeah.
Yes.
Yes, thank you. Sorry, no 1 minute left, but just to quickly say, to quickly answer your question, not in any detail, obviously. Even with a ceasefire, there will be people still vulnerable, right, and needing assistance and needing these social protection systems. So great that there's, kind of progress towards that. So we'll look forward to, see how that that continues, and happy to join a discussion on that as well.
Okay, so I think that we've reached the end of the session. It's now 4 o'clock. I just want to thank you, Cynthia and Farah, for this brilliant work that you shared with us. I think that this is really interesting. We wish you good luck with what is coming after this paper. Thank you everyone for your participation. We will share the PowerPoint with all of you, the recording as well. And then a kind reminder, if you would like to be added to the CAMEALEON mailing list, please register in the form that we shared at the very beginning. I will put the link now again here so you can have it as well. And thank you very much, and have a lovely afternoon, everyone, evening. Bye-bye.
Thank you, guys. Bye.
Thanks. Bye.
Bye-bye.